Hi, Fred Page. I'm doing my neuro assessment. First, I want to start with testing my patient, asking him some questions. What is your name?
Baltimore,
Okay. And where are you located right now?
Murfreesboro,
Okay. And what is today's date?
November 6th.
Okay. Alrighty. And then I'm going to ask you a question. What would you do? Um, how would you cross the street? What was the first thing you would do?
Make sure to look both ways.
Okay. Alrighty. And then next, I'm going to use my ophthalmoscope. I'm going to look into his left eye with my left eye with my ophthalmoscope. I am examining his eye. I am zooming in a 15-degree angle. And I'm going to do the same thing with his right eye, with my right eye. Zooming in a 15-degree angle. Okay. And then next, I'm going to shine a light, checking for constriction. That eye, as well as this eye. Okay. And after doing that, I'm going to one shining light into his eye. His pupils are rounded, reactive. And then I'm going to have you next. I'm going to have you follow my finger, but please follow your finger with my eyes and not with your eyes, and not you move your head. Okay.
Okay.
So look straight. All right. Start off. Okay. Good deal. All right. And then next, I'm going to have you to um clench your teeth. No, this is mine. Just clench your teeth like that, and then you clench from side to side. Okay. And then next, I'm going to do a test. I want you to tell me this object is, does it feel soft or sharp? Okay.
Okay. Smooth. Sharp.
Just this side.
Smooth. Sharp.
Okay. All right. Then next, I'm going to move on to my. I'm going to ask you to raise your eyebrows and smile and puff your cheeks out. Okay. All right. Then next, I'm going. This test I'm going to do is going to be a test to where I'm going to put my finger over this ear, and then I'm going to whisper something opposite ear. You tell me what I said. Okay.
Okay. One, two, three.
Do this side.
Bananas.
Okay. All right. And then next, I'm going to move along. I'm going to ask you to swallow first. And then I'm going to have you open your mouth and say ah. And I'm checking the uvula is midline, and as well as the soft palate is moving as well. Um, then I'm going to move along. I'm going to ask you to, I'm going to place my hands on your shoulders, and then I'm going to have you shrug your shoulders up and down, okay?
Okay.
All right. And one more time. Okay. All righty. And then next, I'm going to shine a light in your mouth again. But this time, I'm going to ask you to stick your tongue out. And the tongue is midline. Okay, good deal. All righty. And then next, I'm going to do test your reflexes. And I'm going to start with your brachioradius. So just have you this on right here. And find the radial pulse. Go up about 2 or 3 centimeters. And I'm going to tap with your hammer, okay? And she'll give me a reflex. Just leave them. Okay, try one more time. 1, 2, 3. Okay, all right. Got a reflex there. And then next, I'm going to do your biceps. Your biceps. So I'm going to have you actually make a flex your arm. Okay, and then I'm going to have you relax. And then I'm going to tap. Okay, 1, 2, 3, tap. Okay. Try it again. 1, 2, 3. 1, 2, 3, tap. Okay. And then the next one's going to be your triceps. And the triceps, I'm going to ask you the back of your arm. It's going right above your elbow. And I'll do the same thing. I'm going to tap your arm, okay? Right above the elbow. Okay. All right, so triceps. And then that's the upper extremities. Next, I'm going to move down to the lower extremities. I'm going to start with your knee, with the patellar reflex. And so therefore, I'm going to have you pull up one of your pants leg for me. And then the patellar reflex. We're going to go out the center part. And then want to tap, okay? 1, 2, 3, tap. So try it again. 1, 2, 3, tap. Okay, all right, that's a patellar reflex. And next I'm going to do the Achilles. And so basically that'll be the back of the foot. And so I'm having you actually just turn a little bit because I'm going to pull the back of your sock down. Yeah, turn a little bit, like turn to the side. Here. And actually here, back of the heel, and the heel right here. And for us, next you will tap. 1, 2, 3, tap. Okay. All right, good response right there. And next the Achilles reflex. So then next I'm going to do the Bambinski. So with the Bambinski, I'm going to have you sit back across the bed for me. And that goes to this. So that. And then I'm going to take an object. Just so you know, I'm going to take an object and I'm going to run from the bottom of your foot to your toe, okay? Okay. All right. No positive reflex. Bambinski. Next. And then I'm going to do your clonus reflex. That'd be the next reflex that I would do. And with this, the clonus reflex, I want to have you dangle your foot. And I'm going to have you, so you can sit on up. And then I'm going to have you dangle your foot for me. And then I'm going to have you push down like you're pushing a gas pedal. Push down. Okay, up. Push down like your resistance. Push up and push up. Okay. All right. The clonus reflex. And then next, after doing the clonus reflex, that takes care of my lower extremity reflexes. And then I'm going to move over to my sensation. My sensation. So I'm gonna have you close your eyes. And it's gonna be basically like I did on your face. Close your eyes for me. And you tell me if you feel something sharp, or do you tell me how it feels. Does it feel sharp? I'm going to actually do it on both sides. So I'm going to be actually feeling you on both arms and actually both legs as well. So you tell me if it feels the same on each side, okay?
Okay.
Okay. First, I'm going to do it with the soft side.
Yeah.
No, I'm going to be comparing it. You just tell me if you feel the same on each side.
Yeah, the same.
Okay.
Yeah, I feel the same.
Okay. All right. And now that's the upper. Now I'm going to do your lower. Wait till I do both sides, okay? And then tell me. Because I'm comparing both legs. So you tell me if you feel the same after I touch both legs. Feel the same?
Yeah, I feel the same.
Okay.
Yeah, feel the same.
All right. All right. Okay. All right. After that, I'm going to ask you to stand up straight with your arms. Stand up straight with your arms. And then I'm going to ask you put your arms out like this. Stand for me and face this way. Put your arms out this way. Okay. And then I'm going to have you follow me. I'm going to have you stay right there. Straight, you be lined with the chair. And I'll have you take your hands and put your finger to your nose. One hand at a time. Go back. All right. Thumbs up. Okay. All righty. And then next, you okay? You can stop. Next, I'm going to have you do you did nose to finger, finger to it, okay? And then I'm going to have you palms up, and then I'm gonna have you you can have a seat. What I'm gonna have you do is I'm gonna have you um, thumb to pinky, and then you're gonna do each finger 10 times. Just touch each finger, thumb to pinky, and then do and alternate the other fingers to your thumb. Yep. Do it real quickly, many times you can. Okay. Good job. And then next, I'm going to do your lower, similar to what we just did a while ago. But I'm going to take it, and you're just going to pat my hand real fast, okay? Okay, that foot. Same thing with this foot. Okay, all right, good job. Okay, then next, I'm going to have you fix my chair. And then next, I'm going to have you close your eyes and put your hands out like this. And I'm going to have you count to 10, okay? Keep your eyes closed and count 10 to 10 out loud for me.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
All right, good deal. You go open your eyes now. And there was no swing as he counted to 10 and had his palms up. You're fine. Okay, and then this last one, I'm going to have you walk. Just have you take a few steps towards the chair and take a few steps back to the nightstand. Just turn around and walk. Okay, all right. And then I'm going to have you do heel to toe. Hold on a second. Have you do heel to toe. Walk and just do heel to toe and just a few steps, and then turn around and do the same thing back. Observing your gait and your stance, and there's no deviations or anything like that, and also to observing your posture and it's straight upright. Alrighty, that concludes my neuro assessment. Thank you.